Welcome to Unicate Talks, where we turn complex science into conversations that matter. In this episode, we're exploring a condition that affects the way we breathe, both literally and socially, across all ages and communities. Asthma. Asthma is a chronic lung condition that causes the airways to become inflamed, narrow, and overly sensitive to triggers. When someone with asthma is exposed to something irritating, like cold air, dust, pollen, exercise, or stress, the muscles around their airways tighten. At the same time, the lining of those airways swells, and mucus production increases. This combination makes it harder for air to move in and out of the lungs. And that's where the familiar symptoms come in: wheezing, coughing, shortness of breath, and a feeling of tightness in the chest. But asthma isn't just about occasional breathlessness. In poorly managed cases, it can be life-threatening. An asthma attack is a sudden worsening of symptoms that can happen quickly and escalate fast. If the airways become too tight or blocked, oxygen can't reach the bloodstream as it should. That's why understanding asthma is not just medical, it's also life-saving. From a scientific point of view, asthma is an inflammatory condition of the airways. That inflammation doesn't go away. It sits quietly even when someone feels fine. This is why long-term management is so important. We can't just treat the symptoms when they appear. We need to prevent flare-ups from happening in the first place. In clinical settings, asthma is diagnosed using lung function tests, a review of symptoms, and careful tracking of triggers. Some patients use peak flow meters at home to monitor their breathing each day, checking for dips before symptoms even begin. Healthcare professionals also encourage written asthma action plans, documents that explain how to manage daily care and what to do in emergencies. What does treatment look like? Well, there are two main types of medicines: preventers and relievers. Preventers, like inhaled corticosteroids, are taken every day to reduce inflammation and keep airways calm. Relievers, such as short-acting bronchodilators, are used when symptoms flare up and act quickly to open the airways. Some patients with more severe asthma may also be given long-acting medications, leukotriene blockers, or biological therapies. The aim is to keep the lungs as stable as possible, day to day. The CDC recommends a full asthma care approach, not just prescribing medication. That means educating patients about their condition, checking inhaler technique, screening for smoke exposure, removing home triggers like mold or pests, and connecting care between home, school, and clinic. It's a shared responsibility between patient, family, and health professionals to keep asthma under control. Let's consider a real-world example. Imagine a 9-year-old child in a busy urban school. Their classroom window opens onto a street with high traffic. At home, there's a pet cat and occasional damp on the ceiling. Without guidance, their asthma may worsen, leading to missed school days and ER visits. But with regular medication, teacher awareness, air purifiers, and help from a school nurse, that same child might not need emergency care at all. That's the power of proper asthma management. Asthma doesn't have one face. It affects elite athletes and school children. It appears in families with no history and in communities already dealing with housing issues or poor air quality. It's shaped by biology, but also by the world we live in. So, public health responses must be wide-reaching, and treatment needs to be individualized. At Unicate College, we teach our students to connect science to human experience. Our public health, environmental health, and health promotion programs empower tomorrow's professionals to understand chronic conditions like asthma from both a clinical and social perspective. If you're ready to change lives by helping people breathe easier, literally and figuratively, Unicate is here to support you. Thanks for listening to Unicate Talks, and a sincere thank you to Dr. Watkis, biomedical scientist and Fellow of the Royal Society of Public Health, for guiding this episode and bringing a deeper understanding of asthma and the systems that support its care. Until next time, keep learning, keep breathing, and keep taking science forward.